మనీషా నువ్వు మొన్న బిల్లింగ్ మిస్ అయిపోయావు కదా. ఓకే. సో యాక్చువల్ గా ఇక్కడ మెడికల్ బిల్లింగ్ ఉంది కదా. సో ఫ్రమ్ దిస్ మెడికల్ బిల్లింగ్, సో జస్ట్ వీ హ్యావ్ టు నో ద ప్రొవైడర్స్. సో ప్రొవైడర్స్, దాంట్లో ఇండివిజువల్ ప్రొవైడర్స్, ఫెసిలిటీ ప్రొవైడర్స్, వీళ్ళందరూ ఉంటారు. సో ఇండివిజువల్ ప్రొవైడర్స్ ఆర్ పీసీపీ, ప్రైమరీ కేర్ ఫిజిషియన్. ఎస్సిపి ఈజ్ నథింగ్ బట్ స్పెషాలిటీ కేర్ ఫిజిషియన్. దీంట్లో ఫెసిలిటీలో హాస్పిటల్, అంబులేటరీ సర్జరీ సెంటర్, స్కిల్డ్ నర్సింగ్ ఫెసిలిటీ, home health, hospice. So here in the CPC exam, they asked the question regarding ambulatory surgery. So which of the following is correct regarding the ambulatory surgery? So ambulatory surgery is nothing but does not require overnight stay. Overnight stay చేయాల్సిన అవసరం లేదు. దీన్నే డే సర్జరీ లేదా సేమ్ డే సర్జరీ అంటారు. సో ఇట్ ఈస్ కాల్డ్ as డే సర్జరీ ఆర్ సేమ్ డే సర్జరీ. సో ఎగ్జాంపుల్ ఈ క్లియర్లీ గివెన్: ఐ సర్జరీ, cataract, laparoscopic surgery, ear, nose and throat procedures. And then they will ask what is the hospice. Hospice is nothing but the person who is terminally ill. They are called hospice. They are not with life expectancy more than 6 months or less. So within the 6 months they can expire. So treatment is terminal ill stops the during the hospice care. So then treatment will be the stop because already they won't like right. They will expire within the 6 months something. So the treatment will be uh, not given to them patient. Only symptom management and treatment for any other illness is provided. Okay. Example: cancer, HIV, ESRT. Suppose if HIV related any symptoms, na, cancer related any symptoms, na, they can give the treatment management. That's it. But they won't give the treatment during the care. Okay. So that is called hospice. తర్వాత హెల్త్ ఇన్సూరెన్స్. హెల్త్ ఇన్సూరెన్స్ దెర్ విల్ బి అనే లైక్ ప్రైమరీ ఇన్సూరెన్స్, సెకండరీ ఇన్సూరెన్స్. Suppose we are having phone pay, no? In phone pay, like primary account, secondary account, like that. Same the patients who is living in the USA, they are having the insurance like primary insurance and secondary insurance, supplemental insurance, and all those things. So the insurance which is having in primary position, that is called primary. The insurance which is in secondary place is called secondary. After the secondary, third, fourth, fifth, any insurance is there, that all are called as supplemental insurance. So here payers are three types. Previously we seen the provider: individual provider, facility provider, primary care physician, specialty care physician, and hospital facility, and all those things they given. Here the payers are three types: federal, private, liability. Federal means government insurance. In the CPC exam, they asked many times which of the following insurance comes under the federal. So they will give Medicare, BCBS, United Healthcare, Molina, something. So Medicare is federal. So four insurance comes under the government insurance like federal, and also it is non-commercial insurance. Coming to the private insurance, the other name is called commercial insurance. For government insurance, it is called as government or federal or non-commercial insurance. So these are the four types of insurance: Medicare, Medicare, and Tricare and Champa. Coming to the private insurance, DCBS, Managed Care Organization, commercial insurance. Liability two: auto liability and worker compensation. Auto liability is nothing but suppose any vehicle accident, na, that is called auto liability. Worker compensation, na, the employees who are working in the company, if they are affected with any sudden situation, that comes under the worker compensation. Okay. After that, we are going to study about the non-commercial insurance like Medicare and Medicare. So they will ask in the exam or interview what are the eligibility for Medicare. So to get the Medicare insurance, The person should be the 65 years or over, and below the 65 now they are having the certain disability or ESR depression. For these three conditions only, the Medicare is applicable. Okay. So the Medicare is having the four parts: Part A, Part B, Part C, and Part D. Definitely one question come from here. Part A covers the inpatient expenses. Part B covers the outpatient expenses. Part B covers the, just you remember, A means admit. The people who is admitting in the hospital, that is called inpatient. Okay. Part A for admission. So that is called inpatient. Part B for outpatient. D for drugs. D for drugs. Okay. A for admit like inpatient. B for outpatient. D for drugs. Okay. Very, very important. After that, Medicaid. The Medicaid is having the people who is like poverty, low poverty income people, and blind and orphans, for everyone. This covers the Medicaid. And there is no patient responsible in most cases, but in some cases, spend on charges, copay is applied. Please needs to be renewed monthly. No, nothing. So just you can remember that Medicaid is payer of the last resort. After all insurance payment done, then only the Medicaid insurance will be paid. After the Champas and Tricare, this will be the like a government, like a defense and army, military, navy. For them, the insurance which is having that is Champas and Tricare. That's it. After that, commercial player. I already told you, no, commercial player is nothing but player is nothing but like private insurances like Aetna, MCO, other than Medicare, Medicaid, Tricare, Champa, other than this, any insurance is having that comes under the commercial payer. That is nothing but private insurances. These and all non need. Auto liability already, worker compensation. See, the plan only covers a related problem, work related problems only. After that, claim forms. From the claim forms, one question may come. What are the claim forms are used for the physician billing? They will ask. For physician billing, the claim form is used, that is CMS 1500. Whereas for hospital billing, the claim form is used, that is UB04. Is very, very important. Okay, how you can able to remember now? Suppose it will be written in the reverse format now. It shows like H, right? So like that you can remember. UB04 na hospital building, like that you can remember. Remaining obviously it comes under the physician building. Suppose if we make it like U like this na, if you write U same in the reverse format na, it is look like a H, right? So then you can UB04 is for hospital building, right? You can remember, okay? And CMS 1500 na, it is for physician building. Definitely, most of the times they asked what are the claim form are used for the physician and hospital building. After that, place of service. This place of service codes will be available in the CPT code book, third page, and again it is also available in the HCPCS book. So from there you can check the place of service. Here no need to do anything. Okay. After that they ask the abbreviation most of the time. What is NPI means National Provider Identification Number. PIN means PAR Identification Number. Provider Identification Number. TIN means Tax Identification Number. Most of the time in the examination, they will ask the TIN only. After that, RVU. RVU is very, very important. What are they will ask directly? What are the units of RVU? There will be RVU related 3 units are available. That is work RVU, practice expenses, malpractice. That's it. No need to remember formula and all those things. Just what are the units of RVU? Just there are 3 number. So first one is work RVU, second one is the practice expense RVU, third one is the malpractice RVU. That's it. After that, billing terminology. ABN is very, very important. They will ask sometime what is the abbreviation for ABN. ABN Advanced Beneficiary Notice. Or for why ABN form is used means it is an advanced beneficiary notice is a form signed by you that shows that the test is performed by doctor may not be covered by the Medicare. So some of the services it is not covered by the Medicare. So before that they will get the form. We have to get it signed on that form. That is only the ABN notice. It is given by the Medicare. Okay. After that, birthday rule is nothing but suppose even newborn baby, either boy or girl, they don't have any insurance. So at that time, either mother or father have to give their insurance card to the hospital to cover the insurance for their baby. So which insurance card is accepted means whether father or mother means who is the mm, date of birth is earlier. Earlier is nothing but చిన్నవాళ్ళు అంటే ఎవరైతే ఏజ్ లో చిన్నవాళ్ళు ఉంటారో who is having the age less age they only cover their babies health related expenses. Okay. So suppose if father is having 2000 and mother is having like 2001 year, so mother card is accepted for their baby. Okay. The birthday rule is endorsed by the National Association of the Insurance Commissioner. The birthday rule states that the plan of the parent, whose date of birth month day falls earlier in the calendar year, is the primary plan of the dependent children. Okay, next to co-insurance, na another insurance. Okay. Suppose one insurance does not pay it fully, so another insurance is act as a to pay the some amount towards the patient charges. That is called co-insurance. Co-pay means initially the patient when he went to the hospital, suppose he is suddenly coming to the emergency department something. So initially you have to pay the some amount before the treatment. That is called co-pay. Insurance co-pay amount money percentage charges basic supplemental health services member required to pay set up forth by the health plan. A co-pay is often associated with an office visit or emergency room. Yes, initially whatever we are paying before the treatment starts and insurance card is applied, that is only the copay. Suppose if you are entering into the hospital now, to get the approval from Arogyasri like that, it will take time now. Up to that, we have to bear all the cost of the from our end only. That is called copay. So deductible na an insurance deductible is minimum amount of the patient must pay before the insurance carrier will pay any toward the charges. Usually the deductible needs to meet the paid for the patient each year. So deductible is nothing but when we are taking loan, so they will collect the loan charges like that before we are taking any insurance, no? So before only we have to pay some charges like that. And also there will be an deductible like monthly or yearly it will be available. So that is called deductible. After the global days is very, very important. For minor surgeries, the global days will be the like 0 to 10 days. For major surgeries, no 0 to 90 days. So minor surgeries, no like eye surgery, or incision and drainage and repair and all these things comes under the minor surgery. Major surgery, na, it comes under the cesarean and fracture. So and all those things it will be comes under the major surgery. Okay. After that, fraud and abuse, definitely one question will come in the CPC exam. So fraud and abuse is nothing but here they clearly written knowingly billing or service not furnished. Suppose supply is not provided, they are not doing nothing, but they are representing as a done something. So that is called fraud. Knowing billing services at level of complexity higher than the service actually provided documented on the file. Knowing submitting the false statement and making the mispresentation. Knowingly paying and accepting remuneration referrals. So in our India, the RMP doctors mostly, if they refer to the corporate hospital, they will get the money. But in USA, they won't accept these referrals and all those things. If anybody doing these referrals, na, they will get it fined actually. So it will be on a very strict. Suppose if any doctor or any nurse, any medical practitioner is doing fraud, na, they will get jail up to the 10 years and they will get the fine up to the $5 lakh. Okay. So here some words are given for fraud, billing for service not rendered, altering medical records, use of licensed staff, drug diversion, providing unnecessary services to the members. These are comes under the fraud. Coming to the abuse, abuse is nothing but by simply what we can say, they can done something, but when they are billing now, they are giving the more billing like that. So abuse described practice that either directly or indirectly result in unnecessary cost to the medical program or member. Abuse include the practice that is not consistent with the goals of the providing patient with the service that are medical necessary, meet professional recognized standard and priced fairly. So billing service that were not medical necessary. Actually, what is meant by the medical necessary? What is meant by the medical necessity? Na? So here they clearly given medically necessary means many insurance policies will pay only for treatment that is deemed. Okay. Medically necessary to restore the person health. For instance, many health insurance policies will not cover the routine physical exam, plastic surgery, and cosmetic purpose. That is medical necessary. Medical necessity na justifying that the service is rendered or item provided reasonable. Okay. So for that, they are charging exclusively for services and supply medical billing services that were not medical necessary. Actually, for treatment and all, it is not necessary, but still they are taking and operating the procedure with the different instruments and getting the payment like that. So that is called abuse. So these and all no need, okay. And after that, OAG, or they will ask the what is the abbreviation for OAG and what are the roles of the OAG. You know, OAG means Office Inspector of General, and also the what they will do means the main function of this OAG means they will do the audits and investigation and inspection and other related functions. And after that, HIPAA. HIPAA is very, very important. Most of the time they will ask me. HIPAA stands for Health Insurance Portability and Accountability Act, and it is implemented in the 1996. So very, very important. So that's it. And after that, they will ask regarding the global surgical package. Global surgical package means if you suppose if you went to the hospital, na, the doctor will speak to the patient regarding the global package. If they undergone any surgery na, for room cost and all, they will give the more, they will get the more money. At that time, the patient will speak with the doctor, and the doctor decided to surgical package. Surgical package, na, once if he entered into the hospital, after taking the room and surgery and everything, they will speak about the one ప్యాకేజ్. ఒక ప్యాకేజ్ మాట్లాడుకుని ఆ ప్యాకేజ్ లోనే ఇంక మొత్తం కవర్ చేశాడు. మందులకి మళ్ళీ సపరేట్ అమౌంట్, మళ్ళీ ల్యాబులకి సపరేట్ అమౌంట్, మళ్ళీ ఆపరేషన్ కి సపరేట్ అమౌంట్, అలా కాకుండా ప్యాకేజ్ మాట్లాడుకుంటారు. సో మళ్ళీ ఐసీయూలో కనుకుంటే ఎక్కువ కాస్ట్ అలా ఖర్చు అవ్వకుండా, సో సర్జికల్ ప్యాకేజ్, ఆ సర్జికల్ ప్యాకేజ్ లో ఏమేమి ఇంక్లూడ్ అవుతాయంటే pre-operative. Pre-operative is nothing but before the operation, patient kept under the observation, right? So after that, intraoperative. Intraoperative is nothing but during the operation. Post-operative is nothing but after the operation. So these all considered under the global surgical package. So most of the time they will ask the pre-operative stage includes. So in pre-operative, what are the services are included now? Local infiltration, metacarpal, metatarsal distal block, topical anesthesia, subsequent sedation surgery. So local infiltration, metacarpal and all those things. No? So patient get ready, and after that they will put the cannula and all those things, and some any topical anesthesia will be given. So these all comes under the pre-operative. Intraoperative na actual performance of the surgical procedure. Intraoperative na during the operation, they'll start the procedure. After the post-operative na immediate post-operative care, including the dictation and post-operative note, talking with the family and other physician, writing orders, evaluating the patient post-anesthesia recovery area, topical and complicated post-operative care. These all comes under the post-operative services. Okay, that's it. This is about the medical billing. In the CPC point of view, it will get like three questions from here. So in here we are going to study like medical billing, but coming to the NCPC exam, it not like that. So the name with the compliance and regulatory, the name will be the available in the CPC exam. So we have to click on the compliance and regulatory, and then the question will be the open. So we have to answer it. Suppose three questions are getting, so each carries the 33.3. Suppose if you make the two questions wrong, na, you will get only 33 only. So for easiest places, we should not do the mistake, because if you do the mistake now, we will get the more marks in the average. So then automatically our result will get it like 69, 68 like that. There and it will stop. So anatomy 25% each question, and HCPCS and billing 33% like that. For CPT now, one question is carry 17%, 17. HCPCS also each question carry 33%. Coding case studies na each question carry like 10%. 10 questions will be there. 10 into 10, 100. Like that. Okay, now just you can follow. Okay. So you can go through this medical billing. So we'll share the questions also for practice, and you can better to go through that. Okay. Just a minute. I will share the questions also. Okay, just you can try to practice these questions. And I also will share the recorded session also. ఓకే, దట్స్ ఇట్ అమ్మా, యూ కెన్ గో త్రూ దట్. ఓకే, ఈవినింగ్ మామూలుగా మీకు హెచ్సిపిసిఎస్ అవి చెప్తాలి. ఈ రోజు వరకు బిల్లింగ్ చదవండి, ఓకేనా? ఈవినింగ్ హెచ్సిపిసిఎస్ క్లాస్ చెప్తాను. సరే అమ్మా.
ఓకే. థ్యాంక్ యూ.
Yeah.